Hi, I'm Dr. Brant Pedersen, and in this video, we're going to go over everything you need to know about sacroiliac or trochanteric belts. An SI belt is a great way to help provide stability to your SI joints, and SI joint pain is a commonly misdiagnosed condition that can cause low back pain, pelvic region pain, even pain into your hips and down your legs. But diving deep into trochanteric belt and the frequently asked questions that I get about them. How do I put it on? How tight do I wear it? How long do I have to wear it? Can I do activities while I'm wearing it, like exercising? Can I wear it when I'm sleeping? Will it atrophy my muscles? There are a lot of different questions that I get regularly in my clinic, and so we're going to go over those in this video to help you understand how to get the most out of a trochanteric or SI belt. If you want to know more information about SI joint instability and pain that can come with it, check out this video up here. I'll also put a link down below in the show notes where we go over classic cases, the anatomy, what's going on, and things that you can do to help with it. Let's go. The sacroiliac joints are the joints at the base of your spine here that are made up by your sacrum, this triangle-shaped bone, and your ilium. So sacroiliac joint. It's these joints running right here. You can see them from the back there. You can also see them from the front here. And those joints are held together almost entirely by ligaments. So if you can see here on the back and on the front, sometimes those ligaments get overly stretched. And when they do, we have an issue of SI joint instability. And a great way to help provide stability to that joint and pain relief, if someone has that, is with an SI belt or a trochanteric belt. In this video, I'm going to be talking about Sacroiliac SI belt. But there are a lot of different brands. This is the one I like, and I've used it, a number of them in the past. The reason I like it is the material that's on the inside of it makes it so that it doesn't want to slip down or ride up, which is really important when you're wearing an SI belt a lot. And also the Velcro on it is really, really sticky and tough. Some of the SI belts I've used have hooks on the one side, but they just use the felt of the belt on the other side. Those work really good for a couple weeks and then they stop working. I've got patients that have had and worn these for months, sometimes a half a year or more at a time, and not had any problems with it. I'll put a link down below to where I get these Sacroiliac belts. That being said, if you are somewhere where you can't get a Sacroiliac belt or an SI belt, and you're in a pinch and you're trying to figure out, hey, is SI joint instability my problem, and will I have relief if I'm wearing a trochanteric belt? I'll have people put on a 3-inch or 4-inch ACE bandage, a long one, where they can wrap around the area we're going to show you with the belt a few times, and they can get good relief with that. The problem is it rides up and down. It's kind of cumbersome to put on, but it's something that can get you by and also help you understand if this would be of benefit to you. The sacroiliac belt, where we are going to place it, and that's the first question, right? So putting on an SI belt properly, it's really important. If we're not wearing an SI belt where it's meant to go, we might get little or no benefit from it. And I often see that when patients come back into the office, they're either wearing it too tight, too loose, they're wearing it too high. That's very common. So the belt needs to go around your SI joints. And the way that I teach my patients how to figure out where that is I'll have them bring a leg up, and where the crease is right above their hip, that is where the bottom of the belt is going to go. So when I have them first put it on, I will have them loosen the tensioning straps. This is going to help it so that it doesn't bunch up. You want the belt to be comfortable when you have it on. So if you're not making sure of these things, then it can not be fun to wear. So where the crease is, that's where the bottom of the belt is going to go. And then I'm going to make sure that it is even around so that it's not high up in the back or low in the back, that it's even, parallel with the floor. And that I put good tension on it when I first tighten here. That's going to help so that we don't get bunching. And then what I'm going to do is take and put a little extra tension just into either side. And so we're going to roll that second question in. How tight do I make the belt? Well, you certainly shouldn't have any symptoms that come on with wearing the belt of pain going down your legs or numbness or tingling. That's not something that we would expect. And also knowing that making the belt tighter doesn't necessarily make it work better. It should just be moderately tight. I have my patients be able to put their fingers in there so that it's snug but not too tight. If a person finds that they get bunching in their belt, or that the belt is hanging out down low like this, or that they find crinkles or wrinkles in the material, it means that they either have too much tension on the tensioning straps, or they don't have enough initial tension on the belt before they tension the straps. So start over, loosening those straps, putting the appropriate amount of tension into the belt before you start, and then putting just a little bit of extra tension there. You can wear it underneath your clothes or on top of them. Sometimes people wear a sweatshirt or something, a sweater over the top of it so people can't see. But that is how to put on and properly tension an SI belt. So how long you have to wear an SI belt depends on a lot of different factors. A few of those are your mechanism of injury. How did you first get injured? Did this just come on, not from a trauma or an accident? That's probably going to take less time to heal. If it came on from a severe trauma or accident, those take longer to heal. How long have you had these symptoms and this pain before you started treating it? So someone that's had it for a week, less time to heal than someone that has had it for months or years. Are you on the spectrum of ligamentous tightness or laxity? Are you someone that is either on the tight spectrum or more on the loose spectrum? So a way to figure that out is to take your elbow here. You can see this is me with my arm fully straightened. And some people have their arm go straight or actually have it curve back down. The people that have it curve back down, those people have, in general, looser ligaments. You can also take your thumb and try to bring it down next to your wrist. You can see I can't do that very well, but some people will be able to do that. That's another indication of ligamentous laxity. Same with our knees. If they go into hyperextension, sometimes that's a cause of it. Shows that someone has ligamentous laxity. Someone that has more lax ligaments, it's going to take longer to heal than someone that has more rigid ligaments. The fitness of the supporting muscles around the SI joint, the biggest one of those being the gluteus medius, but also other core muscles, the glute max. Those, in a video that's up here, I go over the exercises that I find help patients the most with those supporting muscles. In my office, we go through and assess the fitness and fatigability of all of the muscles that support the SI joint, and then give specific exercises to help a person heal or strengthen those muscles so that they can heal quicker. But watch this video, it should give you some idea of things you can look into. And then lastly, other biomechanical factors. So there's another video that I've got on the feet and how those can affect everything up into the SI joint and hips. So sometimes the feet for someone, sometimes ergonomic challenges that someone's doing, and certainly things that shear or stress that SI joint. So doing lunges, working on a Stairmaster, doing yoga. Those things aren't bad, but for someone that's trying to heal their SI joint, avoiding those shearing activities help the person not have to wear the belt as long. So the golden question, or the $1,000,000 question, how long will I have to wear it? It really depends on the patient. Sometimes people will wear it for a week or two, but I've had patients wear it 6 months or more. What we're really looking for is a proper diagnosis that the person actually has SI joint instability, someone that feels a relief, because a person should feel when they put on an SI belt, if their problem is SI joint instability, wow, this is exactly what I feel like I've needed. I just feel more safe, more secure. I feel like there's less chance that my back is going to go out. They immediately notice an improvement. And what we're looking for is a patient that gets, or a person that gets, where they feel that I don't have any pain, and even when I take my belt off and I'm going around in my daily life, that I don't have any pain with that. That's what we're ultimately going for, the ultimate goal with anyone with SI joint pain. Lastly, make sure in trying to get out of, heal and get out of your belt, make sure that you're working with a healthcare professional, a good sports chiropractor or physical therapist that can help to guide you along the path and let you know if there are other biomechanical factors that are causing problems, including your SI joint instability. Will an SI belt create atrophy? No, an SI belt will not create atrophy in your muscles the same way that like a lumbar corset brace would. A lumbar corset brace is kind of designed to take over for your core and help support your lumbar spine. And in doing so, if you wear it for too long, it actually takes and makes those muscles get weak or atrophy in your core, putting you at more risk for injuring your back, getting a disc bulge or a muscle strain. The SI belt doesn't actually take over for any muscles. All it does is help to hold those SI joints together, sacroiliac joints together, and therefore allow those ligaments to come back to their normal tension. So someone that wears it for weeks or months doesn't have to worry about atrophying those muscles. Can I exercise with the belt on? Yes, you can exercise with the SI belt on. I have patients go about their normal activities. So they might weight lift. I've even had patients swim with their SI belt on, go walking, hiking, do whatever their normal activities are. Again, trying to avoid those activities. They're shearing the SI joint. It's another reason to have a good, comfortable SI belt if you're going to be out and be active, gardening or whatever it might be. Can and should I sleep with a trochanteric belt on? Yes, it is fine for you to sleep with an SI belt on. The patients that I recommend that for are people that have pain because of their SI joints at night, or they wake up in the morning having more pain. Those are people that usually do better having an SI belt on when they're sleeping. It is not necessary to sleep with an SI belt on. It's just if it brings you relief. If you are having pain in your back or any part of your body that takes and comes on and wakes you from sleep, make sure that you're working with your doctor to figure out the exact cause of what's causing your pain. Sometimes that can be a sign that there's something more serious going on. So make sure that you check with your doctor. So there are many things that you can do to speed up the healing of your SI joints. Check out the video link that we have up here. I'll put it down below as well, to other videos that we have on SI joint instability and things that you can do to help with those, like strengthening the muscles around there, like wearing a trochanteric belt, like looking at something like the feet and seeing, do you have a pattern that's going on at the feet that could be translating problems up? Also, you want, and we've talked about it, avoiding activities that shear the SI joint. So again, lunges, yoga, riding a bicycle with the seat too low, those kind of things. A supplement that I recommend for my patients, and this is not necessary, it's just when someone is frustrated, feels like they've had this for a long time, and wants a little support and some nutrients that helps to support their body healing those ligaments. A supplement that I recommend for patients is called Ligaplex 1 by Standard Process. I'll put a link down below to where I get it. And then lastly, keep educating yourself. Keep working with your doctors. At the end of this video, there's going to be a couple other videos that are related to SI joint pain. If you feel like that's what's going on in your body, continue to educate yourself and learn more and more. There's a lot of things that you can do to help yourself, and that also helps to educate you so you can better talk with your medical professionals about this. If you've liked this video, please give it a thumbs up. Please comment down below. We love to engage with the audience. That's how we got a lot of these questions, is from my patients in my office, but also from the comments that we got on YouTube and the questions that we saw repeated over and over. And also, make sure you subscribe to our channel and turn on notifications. We're always putting out content that helps you to feel better and to understand your body. We believe that the human body is meant to last for a lot of years and really feel good. If you're sick and tired of someone telling you you're just getting old, well, this is the channel where you want to be. We're going to help you understand how to keep your body feeling its best. Until next time, take care.